Now, how do you manage open fractures? So remember, whenever you see open fractures, don't jump and treat the fracture first. Treat the wound first. Wound care comes first, then comes fracture care. Okay. So always keep that in mind. Okay. So how do you do wound care? First and foremost, when the patient comes to you, remove all the foreign debris. Many of these patients will have leaves and muds and stones and things like that at the fracture site. So you clean the area, you remove all these debris. Then the next step is to use plenty of normal saline to wash the wound. You use maximum amount of normal saline to wash the wound. It is said that in type 1 fracture, you need at least 3 liters of water to clean it. In type 2, you have to use at least 6 liters of normal saline for cleaning the wound. And in type 3, we need to use at least 9 liters of normal saline to clean the wound. So this is the least amount of normal saline that you are using. You can use more than this, that is okay. But at least this much amount of normal saline must be used to clean a particular type of open fracture. Then you can use betadine and hydrogen peroxide as analogs to clean the area. Once your wash is done, you go in for debridement. What is debridement? Removal of dead tissues or contaminated tissue is what we call as debridement. So you completely remove all the dead and unclean tissues with a knife and you clean the area completely. Then you can also remove all the contaminants. Then you start the patient on broad spectrum antibiotics. So this is the first step in taking care of an open fracture. You manage the wound first. Once you have finished managing the wound, you go ahead and start managing the fracture. So how do you manage a fracture? It depends upon the type of injury. So if it is grade 1 fracture, you can go in for internal fixation. You can do plate fixation or nailing, it is okay. In grade 2 and grade 3A fracture, these are treated similarly. If the fracture is uncontaminated and the patient has come to you within 6 hours of time, you can do an internal fixation. If the wound is contaminated and the patient has come to you after 6 hours period, then you have to do an external fixation. Type 3B, there is only one option. You have to do external fixation, but there is a large soft tissue loss. So you'll have to call the plastic surgeon and do a plastic procedure. Either a skin graft or flap cover has to be done. In grade 3C, you do an external fixation, and because there is a major vessel injury, you do a vascular repair as well. So this is how you manage the fracture. Now we learned about external fixation. What is this external fixation? It is the treatment of choice for open fractures, isn't it? It is a device by which we put pins or implants on the outside of the body to stabilize the fracture inside.